Hello, guys and students. I am going to have an interview with a gynecologist. In this case, the main objective of this phase 2 experiment is now about the influence with you dealing with pressure in your professional career. In this case, in the healthcare professionals.
Hello, dear doctor. Thank you so much for agreeing to the interview. I hope you are well. The interview is intended to learn more about the life of a healthcare professional. How many years of experience do you have in the healthcare field, and how happy are you right now?
I've been doing this for 39 years, and honestly, I feel very satisfied because, overall, we've been successful in our work with very few complications, and that makes you feel really good.
The second question is, in your experience, what healthcare habits, such as getting enough sleep, eating well, and resting, help young doctors cope better with stress?
Ideally, you should get at least 6 to 8 hours of sleep. But because of the nature of the work, even when you're younger, that's not always possible, since the path to becoming a doctor makes it very difficult to get enough sleep. But anyway, whenever you have the chance, it's best to get enough sleep and eat on a regular schedule, even though sometimes the job itself prevents you from doing so. But that would be the ideal situation. That's what I would advise young people, to make time to stick to their meal schedules and to sleep as much as possible.
The third question is, what small change can a young doctor make to improve their ability to handle stress over the time?
Well, ideally, to reduce the pressure you're feeling, it's best to be well prepared, right? First, and then just take things easy. So you don't put too much pressure on yourself, which could even make you more prone to illnesses that might force you to stop seeing patients or work fewer hours.
The fourth question is, after a difficult case or a complication, what distinguishes a doctor who learns and moves forward from one who gets stuck because of the intense pressure they face?
Well, here it's important to keep in mind that there's a saying in the medical field that goes, if you don't operate, you don't have complications. So you do have to keep that in mind, that we're bound to face some setbacks, but the important thing is to keep going, because I know colleagues who, when they've had a complication, even one as serious as death, have stopped practicing, but that's not the way to go. Instead, you have to keep going and keep preparing yourself, because that's just how it is in the medical field. Taking courses, whether clinical or surgical.
The fifth question is, under pressure, for example, during surgery, what is the key skill a doctor must have to cope, and how does this positively influence the team?
Well, the first thing is that when you're performing surgery, you should never, ever get complacent. You always have to review the entire technique, the entire surgical technique. And that will allow you to feel at ease during the procedure. And of course, the medical team is very important, because if they see that you have the skills and know how to handle the most complicated moments of the surgery, then we'll all work much better together. And of course, you have to choose your team, right? Because ultimately, the surgeon, which in this case is me, is the one who faces the patient. In that case, you really need to be very careful when choosing the equipment you'll be working with.
The last question is, what advice would you give to young people who hope to become doctors or healthcare professionals in the future?
Well, first of all, you have to keep in mind that medical work can sometimes get in the way of family life, so you really need to be prepared for that. Also, the training is very long. It's just 5 years of medical school, 1 year of internship, 1 year of residency, and 4 years of specialty training. So even from that, we can get an idea of just how much dedication it requires. That's what I'd tell you, to look at the whole picture so that when the time comes, you can go through with it happily.
I believe this interview leaves us with a positive lesson. You must face difficult situations with responsibility and great optimism. Thank you for this interview, dear doctor.